When we first started this program almost 3 years ago, it did take some time to go out and do face-to-face visits and encourage people to come and join our meeting, but it took a life of its own, and people saw the good work that we were doing. They heard about it, and they wanted to be a part of it because these are their patients. And at the end of the day, the patients matter, and I think we really make a difference every month that we talk about these patients that are very complex and facing amputation. And if we can save one limb at a time, I think we're doing great work.
On the contralateral limb,
it's a different ulcer that should be...
The goal was to bring together different modalities, different specialties, everybody that had a hand in that patient's care, and really coordinate that care in person. It's exactly what we've been trying to do, and it takes quite a bit of time, and it was pretty impressive to see somebody like Jill Somerset, who is a per diem ultrasound tech, put that together in short order. This kind of a group needs a lot of enthusiasm, it needs a lot of support, it takes a lot of attention, and Jill has shown that. It's what we've been trying to do for a while now.
And she got better. Unfortunately, over a period of time, her wound started breaking down again, and you saw her wound getting worse, and you sent her back.
Cases are selected among the patients we've identified as being at risk for amputation or other bad outcomes. Whoever has been in charge of the care of that patient primarily will give a report about who they are, where they've been, what's been tried, what tests have been done, and we'll open it up for discussion for what do we do next? What options are available to improve their circulation? What other wound healing techniques can we think about next? And how to address their psychosocial issues if that's a barrier. So just kind of a well-rounded look at the situation.
mirror image.
I'd give them one more shot to heal with some product, and if it doesn't, I really think it'll be better with a glove.
It's huge. I think a lot of it, as vascular surgeons, we only look at what is the blood supply to that part of the body, but we also have to take into consideration what is the living situation. If the person is living in a car, let's say, the likelihood of them taking care of their diabetes or their other vascular issues is going to be minimal. So we want to know that so we can tailor our treatment to the patient's needs. So more and more we're taking more of a holistic approach to taking care of the patient.
So unfortunately her wound is down here, so she's got good flow to the bottom of her foot, but unfortunately it's so hot on the top of her foot. So after you ballooned and took care of her popliteal artery,
You scanned her this time?
No, mostly.
I scanned her about an hour later.
So there's probably about 140 patients that have been discussed, some have been rediscussed, and you could multiply that by at least 5 of its impact to the community for the care. Some things that people don't think about is it's a limb salvage meeting, but we're worried about quality of life. And so there are some patients, for example, that an amputation might be better instead of 14 procedures. Yeah, or the risks of doing something fussy just aren't worth it, or the risks are high, but if it works, the quality of life impact will be good, and we can all discuss it, and what's the bailout procedure and everything like that. We spend a lot of time not operating on people, not doing procedures on people, trying to get out of the way of nature to help it heal. But the impact spreads far more than simply the number of patients who have been listed.
And not all, you guys aren't always that, vascular isn't always that solution.
The tiny little gain is good.
At the wound care clinic, we see patients every week, so we really develop a relationship with them. And in addition to that, because we only do wounds, that everything, our successes, kind of our self-worth and our job and everything is wrapped up in whether or not we can get these patients healed, in addition to just really caring about them and wanting them to be healed. So when things go wrong, when we can't seem to find a solution, it's definitely a big roller coaster. And having the limb salvage team has been huge because it opens it up to where when we're having trouble, we can ask for help from other people, and that's really been a huge deal.
So you get a closure of his great staphnous vein. Not only are we helping patients and saving limbs, but actually our program has really allowed us to collaborate amongst specialists. So we're no longer working in our silos, we're actually collaborating as specialists together with these patients. And I think that's where we see the real difference, is we're just a phone call away. And if we can work together as an entire group, a multidisciplinary program, it benefits the patient even more.